weapon called nurse. Now, this weapon is said to be sharp, be strong, be graceful, full of endurance and class, and above all things, a heart of gold. Now, God didn't give nurses just a regular heart. You see, God gave them one with the intensity of the sun, the beauty of the stars. It has the depth of thunder and beats to the sounds of babies laughing, rhythmic and blues, staccato, on or off beats, it moves. And get this, their heart is double the size of Africa. So you know nurses think they can save the world. Both as a gift and a curse, they strap on their armor, comfy shoes, stethoscopes, ready. Walks into the room, ready. No matter what's going on at home, ready. No matter the bills or how long the shift, ready. Nurses are ready. Ready to wipe tears, to stitch wounds, heal broken bones, ready to feed and bathe, ready to read bedtime stories, even if it isn't a luxury known to their own. How heavy is the heart of a nurse with children at home? How heavy is the heart of a nurse with pain of their own? Nurses with their own stress and prognosis, nurses that get overworked, nurses that get sad, nurses that get fed up, nurses that get tired, nurses that are depressed or hungry, nurses that are weak, nurses that hide their tears behind masks and goggles and shields. Essential, they say. But why doesn't the budget include more money for masks and goggles and shields? What about hazards pay and the constant fear of exposure, the constant fear of death echoing in the back of their minds, conflicting thoughts around ethics and morale of procedures? Nurses still have to make their rounds, even on that floor, even in fear, even at high risk. Nurses travel up and down the halls to the melody of heart monitors and breathing machines, all while still reminding themselves to breathe. All while still simply being human and managing humanity. Nurses with anxiety bouncing off the walls, jumping from room to room, patient to patient, the highs and lows of the job, the stress of watching a mother struggle between life and birthing her child, or the joyful tears and shouts after being able to save both, the fullness of seeing your patient walk for the first time, and managing the anger from a patient who has to lose a limb in order to survive, the nightly pleas of euthanasia, or the reward of the ringing bell as a patient leaves the cancer ward, the smiles and thank yous and love given by those healed, and the gratefulness from a grieving family after a transition. Nurses, the daily task of compartmentalization, fortitude, and compassion, all things added to their superpowers, their enormous heart, the gift and the curse. Nurses strap on their armor each and every day, ready to do the job, ready for the responsibility, ready for the unexpected. Word on the curb is that God has a new superhero called nurse, and they are ready and resilient.
Welcome to the First Coast Black Nurses Association webinar. Today, we want to have a conversation about COVID, vaccine hesitancies, all of the different things that nurses are going through in the middle of this pandemic. Today, I have with me members of the First Coast Black Nurses Association. And without further ado, I want you guys to just sit back, relax, and enjoy the conversations. So I'm going to start off with my member to my right, Mr. Allen, and I also have, in other words, can each of you guys introduce yourself, please?
Hello, my name is Alan Williams.
My name is Freddie Webster.
Hi, my name is Alexa Reed.
Thank you so much for joining us this morning. So we're going to talk about challenges faced by healthcare professionals during a pandemic. And I think I'm going to start with you. Could you tell me some of the things nursing students are going through now? Because just think, you're in the middle of your clinical rotation in your classes, and bam, COVID hit.
Yeah.
How does that affect nursing students?
So I came into nursing school in the pandemic, so it was really all online, and that, hinders learning. For nursing, you really need a hands-on experience. But our school has programs, and they actually got us into clinicals, and we were able to have that hands-on experience. So, but I know other schools weren't as lucky, and there's programs that help you online that can shadow health and can let you get that clinical experience, but there's nothing as good as having it in person, So that definitely hindered our learning experience.
Yes, I'm sure it did, but I love having online programs to help you. And the State Board of Nursing was able to do that across the entire United States because nursing students across the board are having the same problems.
For sure. No, we were really lucky to even have programs like that.
Yes.
I've learned a lot.
Thank you. Thank you very much. So I have a question for you. How do you deal with psychological stress in the middle of a pandemic? Because we have some nurses or even students, they might have different views on the vaccines. How do you think that affects a person that might have a difference of opinion from a psychological standpoint?
Well, psychologically, since the pandemic has started, there has been a really big uproar about face mask, covering yourself up, proper PPE daily, washing your hands even more than so. And when you're experiencing COVID at the workplace, you psychologically going to have to think every day that you're possibly going to be exposed to it.
Yes.
And me having, 2 little kids in the house and another one on the way, me working in healthcare at the house, I work at home healthcare, and my patient in there, he has TBI and his mother has breast cancer or had breast cancer. When I'm in their house, I try to emphasize that they need to constantly, wipe down surfaces, clean their hands, and wear their face mask, which they don't like to do, but he can't really wear a face mask because he has a lot of brain damage. When it comes to getting the vaccine, a lot of people are up in the air about it due to the fact that they don't see it as really curing them because they're still catching it afterwards, and the next thing you know, they first got the first vaccine, and then there was another Delta variant that came right after that. Then they got a vaccine for that. Now they want to come out with a Lambda variant, and it just keeps going on and on, which makes you think, like, why get the vaccine then if I'm probably going to catch it anyway? But they say that the vaccine is supposed to be giving you a better chance of survival if you had to go to the hospital, if your symptoms ever progress to that stage. Hopefully you don't have to be on a ventilator because you got the vaccine and your lungs would be more proficient enough to keep you sustained.
Thank you so much. So basically, it sounds like what you're saying, Alan, each nurse has to make an informed decision. You have to think of not only your health, but the health of others, because you're taking care of these people. You're going into these people's houses. You got to think about them. You have a baby on the way. You have 2 small kids at home. You got to think about them. So we have to make an informed decision, and that is the reason for this broadcast today. Thank you so much for sharing that insight. So my next question for you, Ms. Webster, could you talk to us about the higher workload that nurses are facing because of the nursing shortage situation right now? So they have a higher load. How do you think nurses are handling with that at the bedside?
Well, it's really a demanding role for nurses right now.
Yes.
They have the load of not having enough staff. They having the load of being misunderstood a lot of times. And they have the load psychologically, as we spoke of previously.
Mm-hmm.
So as nurses, we have to take care of ourselves so that we can take care of others. And part of that is to have a strong support system at home, spiritually, and on the job. I know many of the hospital teams have a meeting before they go on to the floor to encourage and to give support.
Thank you so much. And I want to back that up with another question, and this is a question for each of you guys. What are your thoughts, and I'll go back to her, what are your thoughts about here you are getting ready to go into the nursing profession, but nurses are talking about being burned out?
I definitely see that in my clinicals where the people that I have to follow around, that they have a lot on their plate, and I can see that, and they definitely are tired. But What was your question again?
What a nurse, how do you feel about the nurses being burned out?
Oh, yes. I mean, I definitely feel like there should be psychological help, like in the hospital too, that someone you can go and talk to and like talk to your coworkers. But I've definitely seen a lot of burned out nurses, and they need help. They need help.
Does it make you think differently about going into the profession because you're getting ready to go into the profession?
For sure. Because I mean, I want to be able to take care of myself, and you have to take care of, just like she said, that you have to take care of yourself first before you can take care of other people. And with that, us being burned out, it's going to be very hard for us to provide care, and I want to be able to be as proficient as possible. So, and with COVID, I know there's a higher workload and more patients and higher acuity patients. So I definitely am scared for that, but hopefully with the help from the hospital that I choose to go to, they will be able to handle that and give us the support that we need.
Thank you very much. So let me go back to you, Alan. How do you feel about, because you're already in the trenches, you're in it right now, and do you feel that you're burned out sometimes?
At the moment, I wouldn't have allowed myself to get burned out because I try to make time for work and make time for home. Although I get messages every single day about all these vacancies, or these people that need me to come to the house or somebody else to come to the house and take care of them, because I'm already working all my weekends already, basically. And they're still trying to make me schedule Monday, Tuesday, and Wednesday to come in. So, you know, you got to protect yourself, because if I keep working and get burned out myself, I'm going to wind up getting sick, and it's not going to be beneficial to anybody.
Exactly. Very good answer. And that's a good insight for other nurses who are watching, for you guys to think about that. Remember what he said. You got to think about yourself first. Thank you. What about you, Ms. Webster? How do you feel about this burned out situation? And can you think of some coping strategies that nurses could utilize? I like what he said, think about yourself first. I like what she said is, I hope that I'm going to end up at a hospital that's going to help me. What are your views on that?
I think definitely you need someone as a sounding board to release the anxiety, the fear, the workload shortage. You need someone that you can talk to and feel not afraid to talk to them, but you definitely need. And spirituality is my outlet.
Awesome.
Definitely prayer.
Awesome. So every single nurse, listen to what the panel said. You got to have some type of outlet. You got to have a support system. You got to have something that is going to help you be able to cope and use different type of coping mechanisms to help you get through it so that you won't be burned out. I also like what Alan said. Number one, from this segment, you got to think about self first. Thank you very much. And now we're getting ready to go into another segment of questions, because these questions are more about management concern. And I have several First Coast Black Nurses members on the stage with me. Would you please introduce yourself?
I am Doris Davis.
I am Jackie Lee.
I'm Petra Cooper.
Thank you very much, ladies, for joining me today. Each of these ladies have served in some management capacity in some way, and that's why we're going to talk about management concerns and challenges during the middle of a pandemic. Some of the issues we're going to talk about would be staff turnover, would be stress. How do you guys deal with the fact when you are getting ready to show up for work and everybody call out? So I'm going to bring that question to you, Petra. Have you ever faced that? You're coming into work, the schedule is all set, but all of a sudden everybody's calling out. How do you deal with that?
So it actually begins before I get to work.
Oh, okay.
My phone typically starts ringing about 5:30, 6 a.m. So I prepare myself daily to check my phone for text messages and voicemails as soon as I rise. Because the challenges are, if the nurses themselves are not sick, someone in their household is. And so they may be exposed if they're not sick themselves or their child is sick. And so we have, coupled along with the increase in our patient census, is that the other challenge is our staff are getting sick. And they can't come to work and take care of our patients. So it's quite challenging every day.
I bet it is. I bet it is. So Jackie, that takes me to you. How do you deal with a high staff turnover? I mean, at the beginning of the quarter, you have your census is a certain number, you got all of your staff, everything is going good. Then all of a sudden, everybody decide they want to quit the job, or you might have 5 or 6 people decide to just walk off the unit. How do you deal with that from a management point of view, Jackie?
Well, for one thing, I would hope that I could discourage them from leaving. Try to get to the bottom of why they're leaving and encourage them to, let's try to work it out where maybe they could stay longer, or maybe there is something we could do to improve the situation for them, the situation that made them, first of all, wanted to leave. So it's a very unique position for an administrator or nurse manager, because we have to have sufficient numbers of staff to take care of our patients, but then we also have to be concerned about the staff to find out what's behind the reason for them leaving the organization.
Thank you so much. So Doris, my question for you, how do you deal with managing conflict? For an example, let's say you have 4 COVID patients on one unit, and all of the nurses are telling you, I don't want that patient. No, you're not giving me this assignment. But what are you going to do? You have a lack of staff. You have a high staff turnover. You have to make hard decisions. How do you deal with that, and how do you deal with conflict?
I've always learned to be proactive in a situation where I plan ahead. So we're preparing. We already know that we already have a lot of issues in nursing, staffing. These issues was there before COVID. COVID just made them worse.
Yes.
So what we need to do is be more proactive ahead of time. So I plan for different things. Policy and procedure is in place for a reason.
Yes.
I deal with conflict on the floor by, we have rules and regulations for a reason. We put in different steps. We might have a steady rotating schedule, so it's evident on when you're going to be there, who's next in line.
Yes.
Dealing with different staffing issues, making sure that we have someone, maybe a float pool, if we're using staffing agencies. Also dealing with different demands on psychological issues.
Yes.
Be prepared. Before, I always tell nurses all the time, talk to patients, talk to employees before a problem presents itself. I should not be coming in to talk to a patient for the first time, nor should I be coming in to talk to my staff on the floor or fellow employees for the first time when it's an issue. We should already be discussing, even if we can get weekly, monthly meetings, finding out what the demands are, what are the issues, what are the concerns, and we may be able to prevent these things from ever happening.
Thank you. That is an excellent way of answering that question, because you got to think about the conflict before the conflict, so that therefore you will be able to come up with a solution. Yes. Very good. So that takes me back to Ms. Petra. How do you deal with lack of, you have a brand new graduate nurse, but all of your seasoned nurses decided they're going to walk off the unit, and you have 5 COVID patients. How are you deal with that when you have, like the student we just had up here, you have a brand new graduate nurse, you're the manager. How are you going to deal with that situation?
So what I found myself having to do is to kind of ask and request of my nurses who are at the retirement age to stay on at least on a PRN basis.
Yes.
Or part-time. And I have 2 of my nurses who have graciously obliged me, and they have helped to train our new grad nurses. They're staying on for that specific purpose.
Awesome.
So what they have, what we have made an agreement is to avoid assigning the COVID patient to my retiring nurse and my new nurse, so that they can focus on our oncology patients.
Yes.
Because that's really our department, and I need my new nurses to be able to take care of oncology patients when this COVID pandemic is over. So that is how I've been working on my unit, is I have worked it out with my nurses who are able to retire. We've worked out an agreement on what we would do and try to prepare our new nurses. So I'm very blessed.
Yes, you are blessed. And I remember writing a paper, an article about retired nurses and how we could utilize the retired nurses to be the preceptors of the brand new graduate nurses. You have all that knowledge.
Right.
I mean, going into retirement, when you, some way you can utilize
Yes.
it. So kudos to you that you're actually utilizing those nurses to help the new nurses. So bravo, very good job. So that takes me to you, Jackie Lee. My question would be, what do you think the future of nurses is like when the nursing profession, when we have a lot of nurses retiring from the bedside, but we also nurses are retiring from the education setting as well. So nurses are retiring from colleges, nurses are retiring from the bedside. So where is that going to leave us for the profession of nursing?
That's a good question and a tough question. It really puts us, the nursing profession, in a dilemma because, as you said, we have to have faculty to teach the students. Then we have to have nurses on the units to take care of patients, precept new students. So it's a major dilemma. But I do like the idea if we could get some of the retiring nurses or retired nurses to come back into the profession, even in education as well as in the clinical area. And that would be, I think that would be a tall task, but it can be worked out with administrators, educators, and staff members sitting together and devising a plan where we can recruit and retain retired educators and administrative nurses to come back into the clinical setting to help with our new nurses and help retain them until they can get to retirement age.
Exactly. So I'm going to give that same question to Ms. Doris because Petra started it off, and what she said was great, that we are utilizing the retired nurses so that as a PRN basis, they are obliging and helping her to train the new nurses, and she's trying her best not to give the new nurses the COVID patients. So how do you feel about that, Ms. Doris?
I definitely piggyback off of what both ladies said. I am all about incentives. Definitely give we have earned the right to get these incentives for us to not only stay, but to precept these new nurses coming in. And you'll have, when you give these different incentives to the nurse, you'll have more nurses wanting to do that. I know for a fact, as I've gotten older, working on the floor is just not my cup of tea. I can't hang with the younger nurses. But if you're giving me the incentive to say, hey, if you come in and you want to precept two nurses or do an education orientation class, or like I do now, professor of nursing, I'll do those, but I can't come in and give you 10 patients on a 12-hour shift, but I can definitely come in and teach all day long. So different incentives to get those, get the new nursing taught, because we have to understand, in order to retain them, we can't scare them away. So you don't want to bring them in and drop them off and leave them, by themselves, because that's where we're losing nurses as well. So we need to be able to, as we get older, or we are older in the profession, to be able to turn that page and give back.
Thank you. Thank you so much. This has been a great segment to speak about management concerns with nursing. Thank you so much, ladies. You guys are appreciated. Thank you.
Hello, everyone. This is CJ Marley, Chief Nursing Officer here at New Orleans East Hospital. I did the research, looked into the science, got the facts, and I got vaccinated 3 days ago. Had a little soreness to the arm site on day one, but no problem since then. Everything's working well. Everything's feeling good. No problems at all. I want to encourage my fellow healthcare workers, men, husbands, sons, fathers, Just look into the facts, get your questions answered, get the research, and get yourself vaccinated. Protect yourself.
We are getting ready to go into our next segment, and in this segment, we will be talking about fears that nurses are facing in the middle of a pandemic. My panel, would you introduce yourself, please?
My name is Deja Mebin.
I'm Dr. Chelsea Ford.
My name is Essence Hines.
Thank you very much for being a part of the panel today so that we could continue with our conversation about the pandemic, nurses, and everything that we're going through with vaccine hesitancy. My very first question would be to Ms. Deja. What is it like, Deja, when you're working in a setting like an ICU setting or any type of hospital setting, and you're probably seeing death and different things around you? How does that affect you as a PCT or a CNA? How does that affect you? Because you know you're a student and getting ready to be a nurse.
Working in the ICU is very tedious, and when you're working with COVID patients, majority of them are on vents, and some of them are not, and you always want to try your hardest to do everything you can to assist the nurses in caring for the patients. So in an ICU setting, just having to make those rounds every hour and report any changes to the nurses are super important. And even as a student, I'm thinking about just how my work, it could be detrimental to those patients' lives, because the nurses are super busy, and sometimes I'm going in the rooms more often. So if I notice any changes, it's just really important for me to report those changes.
Thank you. That's a very good question. And I like the way she said is she's working closely with the nurses. She's watching everything the nurses does. But when she sees something, she report those changes. That's very good. So that brings me to you, Essence, also as a student working as a PCT. What are some of your concerns and what are some of your fears when they are requiring you to do things you may not want to do? How do you handle that?
Honestly, I'm honest with whoever I'm working with for the day. I'll tell them, I'm not really comfortable doing this, or if you have time, can you train me so I am properly prepared to care for the patient? But some of the other fears, obviously, I don't want to harm the patient. Patient safety is number one.
Yes.
Those are like the main two things, just making sure I'm safe and the patient is safe when I'm caring for them.
That's very good. I love what she said. She remembered to do no harm. And that's number one with nursing. No matter what, patient safety is very important. And I think that's very important that you have that instilled with you. And not only that, think about it. As nurses and as students, if you're in an unsafe or uncomfortable situation, speak up for yourself and just say it. I'm just uncomfortable doing that. Or could you train and show me how to do it because I don't want to harm the patient. And I think that's very wise. So now I need to go to you, Dr. Chelsea Ford. Could you tell me about how do you handle situations when nurses are burned out? We've already talked about nurses being burned out. As a result of nurses being burned out, and we also talked about the high turnover rate with nurses, sometimes we are called to go into the workplace setting and help, even though we've been away from the bedside. And I know you did that recently. You actually decided to go on a unit and help out. What were some of the fears and different things you were faced with when you first went on that unit?
Well, it is a unit I'm familiar with, labor and delivery. I've been a labor and delivery nurse for, I worked at the bedside for 18 years. So it's not a matter of skill, but there are things that change through nursing. And having stepped away for education, a lot of that is within the technology, within the system, within the policy and procedures. And again, coming in as a PPN or a premium nurse, you're expected to be able to get all of that information in a couple of days and then hit the ground running. So that was really a lot of the apprehension I experienced was just, again, finding things, computer systems, changes in policy. What are those new COVID policies for laboring patients or antepartum patients? So that was really the high end of my hesitancy going into the workforce.
Thank you, thank you. Thank you so much. And I'm so glad you brought that up about premium nurses. And so my question is for each person on this panel, and I'll start with you, Health Essence. How do you feel that right now they are offering nurses like $60 an hour, some places $100 an hour? How do you feel about that and you're getting ready to go into that profession?
Well, I definitely like those numbers, I'll be honest. Those are real nice numbers. I just wish that it was across the board and not necessarily just for travel nurses. In my clinicals, I've come across nurses that are like, yeah, in a couple weeks, I'm leaving to go travel so I can make more money doing the exact same thing that I'm doing right now. But yeah, the numbers are great, but I do wish it was available to everybody.
Thank you, thank you. Same question for you. Have you worked with any of those travel nurses, Deja?
Yes, over the summer, I pretty much was working with all travel nurses in the float pool. So going to different units, they were short staffed and they had nurses coming in from different agencies. And it does kind of make it difficult because I don't work permanently on any unit and they're travel nurses. So when it comes to finding supplies and just things like that, we're all trying to figure it out. So it definitely affects the flow of things when you're working with all travel nurses.
Thank you, thank you. So my question to you, Dr. Ford, do you feel that these travel nurses are dealing with nurse bullying? Do you see that, or have you experienced that, or do you think that actually happens? Because think about it, if you have a nurse coming in as a travel nurse and they're making 80 or 100 an hour, and then you have a regular nurse working on that unit and they're making maybe 25 or 30 an hour, do you think there might be some tension there?
Oh, absolutely. You see a lot of misuse of power, I'm sure, especially when it comes down to assignments. I'd like to encourage nurses, though, to just really, advocate for the other nurses on the floor, because I do agree with what is also being said about the nurses that are not being paid.
Yes.
What they should be paid to prevent them or to retain them on their units versus them traveling. Speaking with a lot of nurses, I hear that a lot. But the nurses that are traveling in are getting more difficult assignments, and I'm not necessarily thinking that that would be the safest thing to do for the patient's sake and for the unit's sake, especially when you got nurses coming in that are just not familiar with equipment and, rooms and so on and so forth. So I do agree, though, that nurses should be incentivized on the floors.
Definitely, I agree too. So my question, or for the two students, my next question for Deja and Essence, both of you guys, and I guess I'll go to you first. Do you feel that nursing students are Because of the pandemic, do you feel more nursing students are joining the profession or not signing up for nursing schools? Either or, do you think they're like, nah, I don't think I'm gonna be a nurse again, let me major in something else? Or do you think students are flocking to the nursing profession? For each of you guys, so you go first.
I do think that students are still joining the nursing profession because, I mean, for me personally, I majored in something different for my first bachelor's degree, but when I saw the pandemic hit, and I knew I wanted to work in healthcare, so I was like, let me try and give back to the community and go to nursing school so I can, help treat patients and all of that. But even just like speaking with classmates and all of that, like we're all excited to get into the nursing profession. Like we're excited to see what it has to offer all of us. So yes. I do think that students are still eager to go into the nursing profession.
Okay, thank you. What's your take on that, Deja? Do you think students want to continue or they're like staying away from nursing because of their fears?
I think there's a balance, and as far as the ones that are continuing, that just shows the ones who are passionate about healthcare and are going into healthcare for the right reasons. And because the ones who are deciding not to, that just shows that their passion is not there for me. And I think that the pandemic just encouraged me to want to go in more because I'm eager to leave my mark on the healthcare profession and help patients who are in need.
Awesome. Did you hear that? She's eager to leave her mark on the healthcare profession. I love it. And that's a good way of feeling about it. And like you said, you really feel that they want to be in that profession because that's where they want to be. Otherwise, you would have changed your major to psychology or something else. So that takes me to you, Dr. Ford. What do you feel about vaccine hesitancy as it relates to nurses on the front line? They're on the front line taking care of those patients, but yet they have vaccine hesitancy. And unfortunately, some hospitals are walking nurses out of the hospitals and some physicians out of the hospitals because of that. What's your view on that?
Well, that's actually the reason why I took the role, because of the nurses that were having vaccine hesitancy and deciding that, here I am faced with this decision, and I'm gonna walk. And then you have, on the other side of that coin, is nurses that are walking and joining agencies that are not requiring vaccines. And still those nurses are being assigned in hospitals that will accept them as a travel nurse, but not as a full-time employee. So there's that side of the coin. Everybody is entitled to make a decision for themselves. I believe that nurses should be true to their decision. I do agree with these ladies that are true and passionate about nursing and coming into this career. This is something that we've done from the beginning of time.
Yes.
I always say military, then nurses. So once you see it happen in the military, you know that we're next. And we've always, had to do that for the safety of our patients, for the safety of ourselves and our families, and for the safety of our community. Taking vaccines or PPDs or, it's always been something that's been a part of the call into the nursing career.
Thank you. That is so good, because nursing, as everyone indicated on this panel, nursing is all heart, is passion. If you don't have the passion in the heart, find another profession, because it's not about the money at all. It is about heart and passion for the patient. And if you don't have that compassion in your heart, nursing is not for you. If you're willing to accept nursing in the middle of a pandemic, despite the pay, then that shows what, as Deja says, that shows that that's your true heart. And as Ms. Essence said, then that shows this is where you're supposed to be. And I love the way Dr. Ford finalized everything, the way she summarized it. Nursing is all about the heart. Thank you very much, everyone. Thank you.
At the time before I got the vaccine, I was nervous. And I was thinking a lot of the risks. But I also am a mother of 2 girls. You can see their pictures in the background. And every day I'm going out and I'm coming home. And when I found out my grandmother caught it, it would hurt me more knowing that I brought it home to them, in opposed to me just catching it you know, and I felt like even if the vaccine, you know, with all the fears, that I would rather take that risk and put it on myself, you know, instead of knowing there's a possibility I could or can catch COVID and bring it home to my girls. So I was like, okay, at that point, I said, let me be the guinea pig, or, you know, but it's been successful. The only side effects I had was after the second shot. So the second shot, and it was just more pain. I didn't have I didn't have the fever, a lot of the other things that I heard other co-workers experience, but everyone's here and no one got terminally sick. So that's a good thing. So yeah, yay vaccine.
And now we're on to our next segment. Before we go into the next segment, we're going to talk a little bit about nurses and community. But I was so impressed with those students and Dr. Chelsea Ford in the last segment. And I have to talk about nurses eating their young. I will never forget that when I became a new nurse. And I hope that nurses who are watching this, that we will embrace these students when they go into the workplace. We want to embrace them. Why? Because we want them to stay in the profession because they have that compassion and heart for nursing. Wouldn't you guys agree?
That's right.
Yes. So I would like to introduce my panel, my final panel. And could you please give us your name?
Addie Jordan.
Thank you.
Shirley Johnson.
Well, thank you for joining me, ladies. So today we're going to talk about nurses in the community because we're not only nurses at the bedside, we're not only nurses in the classroom setting, but guess what? We're nurses. We're out and about in the community. And as the First Coast Black Nurses, what is our logo? We're the heartbeat of the community.
Right.
We are. So that is what we do. So my first question is going to be for you, Addie, because recently the First Coast Black Nurses, we had to answer the call, and we actually had to help an agency give COVID testing and COVID contract testing and all of that. And you were out in the community like for a long period of time in the middle of a pandemic. How did you feel as a nurse, or how did that affect you being in a community setting in the middle of a pandemic?
Well, I just applied my nursing skills and tried to utilize the prevention for getting COVID.
Yes.
You know, make sure everybody wore their mask and gloves and gowns.
Yes.
When we came in contact with any of the patients, we treated all patients, individuals, as if they could be potentially infected. And there was a lot of teaching going on because we had younger, techs that we had to monitor, and we had the patients we had to teach about the signs and the symptoms of COVID and the prevention of COVID and getting them their information back. So I enjoyed being out in the community. And it wasn't that I was afraid, I just made sure that I was careful and that I utilized infection control technique.
Very good, thank you. And that is so important, utilizing your nursing assessment. She went all the way back to nursing school to utilize those skills. So thank you. So that brings me to you, Ms. Johnson. You did the same thing, out and about in the community. For many months, both of you guys did that particular assignment, and you had to act kind of like in a management type role. You had the whole entire team. How did you deal with that team to make sure everyone on the team followed protocol? Because I'm sure some team members were not on the same mindset to follow protocol. How did you deal with situations like that?
Well, the way I dealt with situations like that was I remember back when I was management at Shands, all the years I was at Shands, and to let them know from the beginning that they had to follow protocol, the same way Addie said. They had to do, and they had no idea because they were used to working like in a doctor's office and, not putting their PPEs on, not talking to the patients correctly,
Right.
Not treating them correctly, privacy, not all that went ahead of it because these were people just walking off the street, just wanting to be tested. And we were testing from babies all the way up, and that was an issue. I think the medical assistants, they wanted to learn. They wanted to learn the right way to do it and the correct way to talk to the patient, the correct way to give them back their information so that no one wouldn't be upset. And the doctors, we had to report them to the doctor, to the health department. We made sure that they knew where their information was going at, that they knew they had to go get the shot or go look for the vaccine because at that time we were just testing. We weren't giving the vaccine.
Right.
Okay, so they were able to follow through to make sure they were doing exactly what they were supposed to be doing.
Okay, thank you very much. So I guess my next question to both of you ladies, what advice would you give to a nursing student straight out of nursing school and they want to go into community nursing as opposed to going into a hospital setting? Do you think it would be best to go straight into the hospital at least a year, get that experience, or go straight to community? I'm going to start with you. What would be your advice?
I recommend them going in the hospital because what they can do is they can utilize their skills that they learned in nursing school initially. Because you have a vast number of skills that you have to use. But if you went into the community, you might forget certain things and you might not know exactly what to do. But you would continue to get that education in the hospital because they have the training, I think, initially when you go in there. So I recommend that they start at the hospital, even if it's nothing but for a year, and then branch out. Because I've have a vast experience, because I'm a military nurse also.
Yes.
And I have, in nursing altogether, maybe about 50 years of nursing. That's a long time.
Yes.
I hate to tell people that, but I have been a nurse a long time. And I'm still nursing. And right now, I'm working remotely from home. And I'm doing quality assurance from home, looking at charts, making sure that they're correct. But I would recommend going to the hospital first, getting that training and that experience, and then branching out.
Thank you. Shirley, could you piggyback on that, please?
Yes, I agree with her because, when we came out years and years ago, I've got 43 years. Years and years ago, it was required that you do 2 years on the med-surg floor before you can go to any specialty. That was a requirement. And I started off CNA.
Okay.
CNA, LPN, RN, go
all the way
up. But I learned everything I was doing because I had got the prerequisite for it. The same way when you go into school, you got to get the prerequisite for what you're going to do. And if you don't get that training, when you get out there in the community, you won't have any compassion, you won't know what you're doing, or you just try to quick start everything. So you need to start to get that 2 years, and I still recommend 2 years. I know that's not how they're doing it now, but that's what I would recommend to the students. Go get your training first. Get it down here so you know exactly what you're doing. If you're going up on a situation, if you can't handle it, then you're going to get your charge nurse or somebody helping you. But you know you have that basic information that you need on how to take care of a patient, bedside care.
Awesome. So you said 2 years, and you said at least 1 year.
At least 1 year.
Okay. Very good. So thank you. So 43 years, about 50 years. So my question, what was nursing like when you guys first? I mean, I'm sure it's different now. Could you tell us some things that they did back then that they're not doing now? Can you think of anything?
Well, I think that a workload is more demanding now than it was when I initially started nursing.
So how many patients would they give you?
Probably about 5 or 6.
Okay.
Whereas in most hospital settings, you have up to about 8, maybe 10, depending on the workload. So, and I was doing some PRN nursing also. So I experienced it when you had to keep running, because I used to work on an OBGYN floor. And I was running from the time I got there until it was time to go home. because the workload, 4 babies, 4 moms. That's a total of 8 patients.
Yes, that's a lot. It is. You're absolutely right. What about you? Is it the workload or something different for you?
What I enjoyed back then, we had team nursing.
Oh,
You had
yes.
team nursing.
Yes.
You had your RN, your
Yes.
LPN, your CNA, and everybody got there and did their part. And you were all go in the room. You do one patient, keep going, to everybody got taken care of. It wasn't, it wasn't the rough patient or the hard patient. You had team nursing, and everybody worked together.
Yes, I remember,
So-
I had team nursing too.
And so did I.
Yeah.
But then when I went to a certain hospital, they started eliminating that middle person,
Oh,
the
yes.
LPN.
Yes.
They cut that LPN out. So you were having just a nurse and a tech to work as a team. And the
Yes.
tech, most of the times, had to do all the vital
All the
signs and the
Bam.
blood sugars. So guess who was taking care of the patient?
The nurse.
That's right.
Yes, yes. The LPN is a very important role in
Yes.
nursing. And I remember there was a time hospitals did not utilize LPNs. How do you guys feel about that?
They don't utilize them now. The LPNs now are in the nursing home.
Yeah, they're in the nursing home.
In the doctor's office.
So
They're
they
not
don't have any
in the hospital.
LPNs in the hospital. Maybe Shands, I think.
Unless they're
Shands.
grandfathered in. If they're grandfathered in, they've been there for so many years, then they have them. Other than that, you cannot go to a hospital and apply for a job as an LPN.
So I was about to say, do you guys think because we're in the middle of a pandemic that now you can do that?
They probably will now.
Because I can see where we're in a pandemic, we have a nursing shortage. LPNs are just as important as the RNs. They really are. So, I mean, and the fact that, as Dr. Ford said, they have such a high turnover, why not utilize our LPNs?
Yes.
That's right.
Yes. So my last question for both of you guys, and I want you to really think about it because, like you said, you got 43 years, you have 50 years, and with all of that knowledge that you've seen from nursing from then all the way to now, what do you think, and I'll start with you, Shirley, what do you think the future of nursing is going to be like because we have of what's going on with the pandemic right now, with the high turnover, nurses retiring? What do you see for the future of nursing?
I think the future of nursing is going to be, to me, I'm an optimist. So I believe it's going to be great. I think we're going to get through this pandemic. The nursing schools are going to start coming back up. Students are going to want to go to school because that passion is still there. If you want to be a nurse and that's your passion, you're going to go through it. You're going to progress through it. And I see this being great. I really do.
Okay, thank you.
And I'm optimistic that this is going to turn around and
Okay,
COVID's
thank
going to be gone.
All right, she's optimistic. What is your take on it?
Well, I agree with Shirley, but I think the roles are going to change a little bit.
Yes,
I think
how?
Well, I think that nurses will be more in management and RN positions. And what was I going to say? Yeah, basically, we're going to continue. And especially if you love nursing, because that's what I like. I like working with the patients and trying to get them better. And if you have that desire, you will continue to want to do that.
Do you think in the future of nursing that they would continue to utilize LPNs at the hospital settings? Because now they're welcoming LPNs back into the hospital setting. Do you think they're going to keep them in a hospital setting when things turn around? What do you think?
I hope so, but I think the motive was cutting out that middle person so that you wouldn't have to pay as much money out of pocket. So I think that was the motive for getting rid of the LPN and reducing your team to 2 people versus 3 people.
So really what you're saying is all about the bottom line.
Money.
Yes.
Instead of helping people and caring for people. Honestly, in some administrations, they
Yes.
have to continue to keep their business and things running.
Yes.
So,
Wow.
I disagree with it because I think you can take care of patients better if you have like that one extra person.
I agree. So I'm going to give you 2 ladies the final word of this entire webinar. And the reason why is because you guys have the most of experience of anybody that's been on the panel. So I'm going to give you guys sorry, Ms. Webster, I'm going to give you guys the final word to summarize everything that we've covered today. Your final word for nursing, if you had to give advice to students or if you want to speak to the nurses on the front line right now with vaccine hesitancy, or if you want to speak to the nurse educators or the nurses that are at the bedside thinking about, maybe I better just leave it. What would be your advice?
I would tell them to continue because people need them, continue to work with them, and it is going to get better. And just make sure they get their vaccination, make sure that they use their protocol correctly, and, the mask and the gown, et cetera. And it will get better. It's going to get better. And also believe the scientists.
Believe the scientists. Thank you very much. What's your advice?
I kudos what she just said, because we've got to believe the science. They know more than we do. They know what's coming, and they know how to treat it, and we should follow them, take our vaccines, take care of our patients, and, we've got to clean everything up. I mean, there's so much that's been going on. We've got to clean everything up, take our vaccines, and follow the science. That's what we've got to do.
Thank you. So I hope that you guys have been educated a little bit of insights from nurses on the front line, students at the bedside, for our two nurses who've been doing this for a very long time, from the nurse managers that was on the floor on our panel as well. I hope that each person watching this, that you took something. You got to have that passion. You got to have that heart. You got to follow the science. We got to stop the bullying, the nurse bullying. We have to embrace our young when they go into the profession so that they can stay in the profession. And I got to go back to what Alan said. You got to take care of yourself. Thank you very much from the First Coast Black Nurses. Thank you.
COVID-19 has taken more lives than we care to count. From the young to the old, all cultures and walks of life have been affected. Be counted among the living. The First Coast Black Nurses Association wants to know:
did you get the shot?
Dreaming about having your own podcast? Want to share your thoughts and ideas with the world but don't know how to do it? Maybe you're excited and committed but don't have a good space to record. Would you like a professional environment to produce all of your podcasts? Well, we have the latest technology from 4K to HD and various set layouts from green screen rooms to live studios. The Inspire Network is an actual television station where our studios are available for rent, and we offer editing suites with the latest technology. We have a makeup studio and beautiful spaces to prepare for your show. Don't forget to ask about our convenient photography studio to capture professional headshots or redefine your new look. Our state-of-the-art facility is intentionally laid out to accommodate your multimedia needs.